Well, of course, literacy, I would say, is the one thing that I've really worked hard on, and trying to encourage parents to talk to their children to improve their vocabulary, but also, to be able to encourage people to learn how to take care of their children. And that one of those things is being able to teach them to take care of their babies in their sleeping habits. It is important for them to put the baby down alone so that the parent doesn't roll over on the child, and to be sure that the baby is on its back so it can breathe well, and then to have it in a crib would be our preferable way. And that's why we're giving out those cribs in the hospitals. We've used dolls to show how to put the baby down, but also it's being used now to diagnose what has happened to the child, the position the baby was in when they put the baby down, where it was, and how it was turned when they found it, if it had died. And so that is one of the tools the GBI is using to investigate deaths. We want to cut those preventable deaths down to none, because we don't need to have children die. And that's been one of the big things that we've worked on, public health and the Governor's Office of Children and Families and the Children's Cabinet. We've all worked on those together. And I think we've done a pretty good job of reducing some of those deaths, but still many, too many.
The thing that I'm the most proud of having accomplished during my time as First Lady in Georgia is that we changed the face of foster care for our state. I truly believe that before we began working on foster care, the system was sort of a black hole. There was a lot of negativity that surrounded foster care. Most of the things that people knew about foster care were those things that they would read in the newspaper, and of course what made the newspaper was typically when you had a failure in the system. My goal was to get people involved with volunteering with foster care, to make it not such a negative thing, but to make it something that people wanted to become involved with. And I truly believe that we were able to accomplish that by talking to all kinds of groups about what foster care was and what foster care wasn't, and encouraging people to become involved, and then making it easy for them to become involved by suggesting things that they could do. Not everyone should be a foster parent. We certainly don't want everyone to be a foster parent, but there are other ways that people could get involved. And so I went around to as many organizations who would have me come and speak, talk to them about their involvement in foster care within their own communities. I think that is one of the things that I'm most proud of having accomplished.
My daughter had played basketball with a young girl who was deaf, and her parents didn't know it until she was almost 3. So I also found out that 90% of the cognitive brain development of a child happens between birth and 3 years of age. Now that's 90% of the total brain cognitive development of a human being happens between birth to 3. So it was important to me to know that a child wasn't missing 2 to 3 years of brain development by not being able to hear. So one night, Roy was working on the budget, and I had been on a trip to Savannah, and I had been talking about newborn hearing screening because Memorial Hospital was doing newborn hearing screening as routine. And none of the hospitals around here did that. Even Northside, who delivers a ton of babies, did not ordinarily do it as without some risk factor. So Roy was working on the budget and trying to cut $50 million from the budget, and I walked in and I said, "How's it going?" And he said, "Well, not too good. I can't find $50 million. I said, "Well, let me tell you what I want." And I said, you know, I've been talking to Dr. Rossiter about newborn hearing screening, and I said it's only a $2.5 million one-time expense to buy the hospitals all the equipment they need to train the nurses and technicians to use it, and then they can be responsible for training all of the new people that come in. They can be responsible for buying new equipment and so forth. And I said, it's only $2.5 million, and it means so much to children and their cognitive brain development and their brain development for the rest of their life. And Roy said, do you not understand that I am looking to cut $50 million? I said, oh, okay, whatever. Well, I had this little Christmas moving figure, Scooby-Doo. And so I clicked the button and walked out of the room, and it turned it on, and it sang Jingle Bell, Jingle Bell, Jingle Bell Rock. Went through the whole thing over and over and over again. About 15 minutes later, Roy says, get this thing out of here. So I went in and I turned it off, and I said, have you found my $2.5 million yet? He said, I'll find it. Just turn that thing off. So I did, and he found it. And in his address to the state, when he gave the budget address that year, he said, now I want to tell you, this newborn hearing screening thing is Marie's, and I'm giving her your cell phone numbers. If you decide to vote against it, she's going to call you. And so nobody voted against that part of the budget. And so we got newborn hearing screening in, and one of my daughters, another one of my daughter's best friends, little boy, benefited from it not too long ago. He failed the test in one ear, and it's a very simple test to do. I mean, the baby's asleep, you attach a little cover thing to its ear, and they do it through brainwaves. And he was able to do therapy because therapy had been put in place. Cochlear implants have been FDA approved now, I think, down to 9 months. So at that time it was 12 months, but there were so many things you could do beforehand. It's very important to me that children hear as soon as possible.
We're never thinking about healthy mothers and healthy babies. A concern that I had at that time, and still have, is how many moms are out there who cannot read a prescription bottle, who do not understand the words that they hear from a doctor or from a pharmacist, and they can't read the printed material that they get about a drug as far as allergies are concerned, and that kind of thing. And so that was always in the back of my head. And any time that I would go visit a site, a GED student site, I'd always ask the women how many children they had, what their ages were, what their names were. Being with someone who was learning how to read, who had small kids, I felt like, well, here's one who's going to be able to. But of course, it's an ongoing thing now. The literacy, to me, that was sort of my hands-on project, and actually contact with people who were participating in literacy programs. So I think more in the public policy area that I began to think that agencies working with clients were not on the same page. And I think a lot of other people were realizing that too. A lot of other people in state government were realizing that that was the case, as the state had such growth in population. And so I like to think that maybe my realizing it had something to do with the formation of the family connection, which of course has expanded, been added on to, still going strong, and has certainly been its development has certainly been an asset to the state as far as communication to families, and a great improvement in the delivery of services.
I did work on the national level, but first I worked in Georgia on immunization. And when Jimmy was governor, I would go to conferences, and the wives they were all wives back then, the spouses were. And we would get together and talk about our programs. And so I would talk about mental health. Betty Bumpus, whose husband was governor at the same time Jimmy was, talked about immunization, and it got me very interested. She had developed a program with the Centers for Disease Control. And so we worked with them and got them interested in immunization, and there were counties all over the state. So we had a really good program when I left. And then when I got to the White House, of course, I had the opportunity to work nationally. And Betty, her husband, had been elected senator, U.S. senator. She called me and said, let's work on immunization in the country. And so I said, okay. Well, of course, I was excited about it. And so we traveled all over this country. In fact, it was so exciting to me because I saw things I'd never seen before. But people were so excited about it. And when Jim was elected president, Dr. Fagin says there's a little argument about whether there were 15 or 17 states only that included immunizations for children 6 years old. The first year, we got it in all the other states and had a big celebration about it, with every state required immunization for school-age children. Just one of the things I'm proudest of.
Mary Beth Busby was a wonderful governor's wife. She was very involved in immunization. In 1978, there became an issue all over the United States that the immunization needed to be looked at because more and more children were having measles, many of them ending up in the hospital. So all the governors' wives were asked to take a step forward and do a lot of things about immunization. So Mary Beth Busby became the chairman of Operation Catch Up, trying to catch these new moms up as far as their children's immunization. And so when I became director of junior clubs in 1980, I was looking for a good project. And I thought, being a nurse and being very involved in moms and babes, I thought maybe I should grab a hold of this project and work with her. And so we, as the juniors of the Georgia Federation of Women's Clubs, sort of looked at why immunize, we care. And so one of the persons that the Department of Human Health and Services said, Pat, why don't you contact Mrs. Busby because she is working on that same project. So I did. So never dreaming that she would come to a meeting with us. So we got busy, and I asked Mrs. Busby if she would come and be our guest speaker at a meeting in Macon. And Mrs. Busby was asked to speak about immunization, how important it was. And she graciously said yes. And so she was there, and we probably had 19 or 20 radio stations that were there to meet her and to publicize what we were doing and listen to her speech, which was very appropriate for the information that we were trying to get out to new moms.
Well, moms are my heroes. It's not easy to take care of children under the best of circumstances, and so I just always look upon those who are raising the next generation as doing wonderful work.
Well, I would like to say congratulations to the honorees. We appreciate you because you are making a difference in the lives of our children. And we want our children, every one of them, to grow up, to be healthy, and to be educated and to have a good life. And you're making that possible through your efforts to help our children. And so we thank you from the bottoms of our heart, because we are so proud of the work you're doing. Thank you.
I think it's an amazing, wonderful honor to be recognized for the things that they've been doing across the state. And what I want to say is that anybody can make a difference in their community and in the lives of those people that they touch. Everyone has a circle of influence, and even though you may not feel like your circle is very big, it's amazing sometimes how the ripple effect can just impact so many lives. So I want to say congratulations to all of the ladies across the state who have done such good work and been instrumental in making sure that our mothers and our babies in Georgia are healthy, are supported, and are in a good place and have the support system they need around them.
I would certainly like to give my congratulations to all the inspiring mothers of Georgia and all the mothers of Georgia, but primarily these inspiring women who have been so instrumental in their communities and with their children. And it means a lot to me to know that these mothers are out there helping. And congratulations, and I hope you enjoy your day.